All right. Hello, everyone. My name is Daniel, and I'll be your co-host for today, along with Katerina, who will be handling the questions and the introduction of our speaker. Before we begin, I would like to start with a land acknowledgement. We may not be physically on campus, but UBC Psych operates on UBC's infrastructure, which is located on the traditional, ancestral, and unceded territory of the Musqueam people. Today's event is UBC Psych's Expert Talk. Psych is one of the largest international honor societies in the world with the purpose of providing academic and professional development opportunities to students. In service of this goal, we have developed the Expert Talk series, a bi-weekly event where we invite professionals in the field of psychology to share their experiences, advice, and knowledge with UBC students. I'll now hand it over to Katerina, who will introduce our speaker and continue with the Q&A.
All right, thank you so much, Daniel. So our speaker today is Dr. Zarina Giannone. She is an experienced clinical sports psychologist who has completed her doctoral training at the University of British Columbia. She has also completed her Bachelor of Arts and Master's degree here, and her dissertations so far have focused on the athletic identity after their athletic careers. She is currently practicing at the Vancouver Psychology Centre and the Canadian Centre for Mental Health and Sport, and she also offers treatment, assessment, and sports psychology services to adolescents and adults. And she is an experienced university educator, clinician, researcher, and leader. She has over 6 years of combined experience on behalf of the executive team of the Canadian Board of Psychologists, and we are so excited to have her here today for our expert talk. And our first section of the questions will be regarding her undergraduate life and experiences. So our first question is, how did your love for the sport of soccer inspire your studying of sports psychology, or was this passion incorporated into an already developed interest? You are a championship soccer player for 4 years for UBC. So we're really interested to see how that influenced your career decisions.
For sure. Okay, I'm off mute. We're off to a good start. Yeah, I'd love to speak to that. I just first want to say hello, everyone. That introduction made me look very good. I appreciate the opportunity to speak with everyone here. Just one note, I already mentioned this to the organizers, but my partner's just in the back, so if he gets up, we're working in tight quarters here, so just FYI, that's who's in the background. Okay, so to your question, yeah, it's an interesting one. I would say that, you know, when you're asked when you're a little kid what you want to be when you grow up, my answer was always a psychologist, and it was kind of a distant dream. Like many little kids, and even like as I grew up, you don't really know what it takes to get there. And to become a psychologist, as you probably are learning, it's a long road. It takes a long time and a lot of dedication to get there. So, it wasn't until a few years into my undergrad where I really realized what I needed to do to step it up and to make that happen for myself. I always obviously had an interest in sport because of my own experiences in high performance soccer. But I would say it wasn't until I started my master's where I really started to blend the two interests, as in practice and in research. And really, I think it was inspired by, some of my research ideas were really inspired by people that I played with, or teammates, or other people within the sport community. So yeah, I would say it's a combination of both.
That's awesome. That's so exciting that you had that sort of already like an interest in psychology and were able to develop that in undergrad. That's amazing. So for those students who have like a similar interest in psychology or are gravitating towards the field, how would you recommend that interested students specialize in clinical and applied sports psychology? What's sort of like the first step in undergrad?
Yeah, so, okay. So I'll give you the quick rundown. because I think it'll just set up some of my other responses, the ones that I'll say in a few minutes here. But there are generally two routes to practicing in the sports psychology space. One is to go the route to become a registered psychologist, which in BC, it's at the doctoral level. And you can practice as a clinical counseling or a school psychologist. And then you specialize in some different kind of areas of practice. That's a traditional route. Another route to work in the sports psych space is to pursue graduate studies in sports psychology housed within kinesiology or other sports science programs. Often it's a science-based degree, like you're primarily doing research, but there is some opportunity to develop some applied consulting skills. However, there's, to my understanding, a bit more of a limited scope of practice that you're able to do along that track. So I would say for undergrads, for the undergrad audience, really focusing on doing what you need to do to pursue graduate studies, because really you can't do much in this kind of specialized space if you're not going on to pursue advanced degrees. So I'm going to give you a generic response here, which is find out what you need to be competitive for grad school. Often that's kind of a research profile, some applied experience, volunteering at the crisis center, things like that. A good academic record, really focusing on becoming competitive while being open to different opportunities to pursue your interests and passions. I think that will help set you up to then decide when you're in that position whether or not you want to specialize in this area or another area.
Awesome. So it seems like flexibility is important when it comes to going into the graduate degree. So branching off of that, what do you believe is the most important sort of skill that you have as a counseling sports psychologist? And is there any particular way to develop that in an undergrad, or is that more specialized towards your graduate studies?
I think there's obviously skills that after, much repetition and practice, you acquire and strengthen, right? And that just is years and years of doing it. But I would say that I'd actually attribute to my experiences as an athlete, which are really kind of flourished in my undergrad, around those skills around self-discipline, time management, grit, hardiness, like all of those things that we attribute often to athletes really apply in the academic space, particularly in competitive programs like psychology. If you really kind of hone in those within the academic space, studying, managing all your assignments, performing to your potential, I do think those things will help you get to grad school, but also help you as you're providing service to folks.
I see. Awesome. Okay, so this next section, you mentioned before the importance of graduate studies for pursuing this line of work. So we will be moving into specialized studies with that. How would you describe the process for obtaining a PhD in counseling psychology? And you mentioned that the process for graduate school is extremely competitive. Do you have any tips on whether the application process or during your actual graduate degree? Do you have any tips for undergrads?
Yeah, so it is, okay, I want to start by saying it is competitive, of course, but people get in, right? So it's not impossible. I would just kind of, what I say to a lot of people, let's work backwards, finding out what you need to do to be competitive and to start kind of doing those things and crossing them off the list, right? People in psychology often see clinical psych as the natural next step. And I would encourage some of you to consider counseling psychology as well. And I'm going to put in a plug for it. There's a lot of crossover, once you graduate with a PhD in counseling psych, in reality, we're providing a lot of the same service, but there's differences and nuance in how that work is done and the populations in which people are typically providing service for. The master's and then the PhD in counseling psychology. From what I've heard, again, I'm not on the admissions committee, but it's my understanding that they want to look more holistically at applicants. So I think something that I was told that I think I made work for myself is, how can I create a story about my application? And the story doesn't appear out of thin air. It's really about how am I weaving together different experiences that I have and interests, and creating a powerful narrative that's persuasive, and that ultimately kind of gets you where you want to go. I don't know if that's specific enough, but that's.
No, of course. I'm definitely getting flashbacks to my undergraduate application with how much they stress the personal profile and how important it is to have that narrative. Thank you so much for that. So yeah, this is a bit more of like a fun question. It deviates a little bit from the talk. Again, there is, of course, what graduate course did you believe best prepared you for your career? But then do you have a favorite course that was outside of your current field? Oftentimes we see that students are stressed to take courses that are very narrow in scope towards a particular career. And we were wondering if you had any external interests that you also sought to develop while you were at UBC.
So it's funny, I'm pausing to think about this one. I've done a lot of courses, and I think I know which ones I didn't like, that's for sure. I would say one of my favorite courses was, I did a specialization or kind of some intensive specialized courses within child and applied psychology. Particularly focusing on assessments. And I found those to be really kind of mind shifting in the sense of learning about, intelligence testing and executive functioning. And it just really wasn't something that was the focus of my training for quite some time, but really shifted the way that I started thinking about things. So that didn't come until my doctoral kind of training, but certainly has had a very lasting impact. So I would say that. I would say that the course that stands out to me the most from my, over a decade being at UBC was a course that I took in my undergrad. I guess in some ways it's connected thematically to psychology, but it was a course, I think it was I'm going to butcher the departmental name, but it was Central, Eastern, and Northern European Studies or something. And it was a course on Holocaust literature. And it was, a life-changing course. And it actually inspired me to travel over to Poland to go kind of bear witness to some of the different concentration camps out there. So I would say that one. It was amazing.
Wow. So it really gave you a different perspective. That's really valuable for courses, especially in undergrad at UBC. You have that flexibility. This is also a bit of a deviating question, but how did you stay motivated in doing your coursework for your degree? I know especially now with doing online learning and especially during COVID, it is difficult for students to focus, especially with distractions in the house. Do you have any particular tips or tricks on keeping that same sort of motivation throughout your degree?
Yeah, I mean, I think motivation is a really big topic that we work with in sports psych. And I would say, a principle that I use very often is, to remember both the process and the outcome, right? So often, I just remember being at the end of undergrad and, being like, oh my gosh, I'm going to be X age by the time I finish my PhD. It just felt so far away. So, remembering not to always go to the end, not always going to the outcome, but really to think about each unique kind of piece of the process as being, you know, something enjoyable, something, an opportunity to learn from. And at the same time, there are moments where you start to question, you know, can I do this? Like, can I, you know, continue sticking this out? I mean, you know, there's kind of impression of doing PhD work where, you know, there's a lot of suffering involved with it, or there can be. And for me, one of the things that helped me stay motivated was imagining myself crossing the finish line. And that was literally, you know, crossing the stage. And I graduated virtually, and that actually didn't end up happening. So that was a bit crushing for me, but it really helped. I used some of that imagery, and that allowed me to stay motivated. And I thought that was really helpful.
I see. Thank you for that. So, pardon the pun, but you got to keep your head in the game.
That's right. That's right.
All right. So our next section will be on your career and research experience. You have alluded to it in previous questions, but our students were looking for more insight. So we were just curious if you had any mentors or coaches that particularly stood out during your research and your graduate training, and what kind of impact they had on your outlook on psychology, on your studies, maybe influence on your research goals. And if not, did you have any alternate resources that were particularly valuable to you, whether internal, external, or something from your courses? So
yeah. Okay, another plug for counseling psych is that I found, at least in my time in the programs there, professors or supervisors really wanted you to pursue things that you were interested in. And there was an infrastructure set up where, you know, you really could bring in your own research ideas to some degree, as long as there was some type of expertise that they could provide, and really encourage to pursue those interests. And so I think for me, it was about being strategic with who I was, you know, paired up with in terms of a supervisor, both in my master's and then into my PhD. You know, my master's, my supervisor, you know, did work in the sports psych space, and she was a registered psychologist. So just a really nice marriage there. And then into my PhD, I actually had a co-supervision arrangement where my main supervisor was in the Faculty of Medicine in the Department of Psychiatry. And so that was just a different kind of lens in which we were able to work from. So overall, I think I would say I had really supportive mentors, ones that encouraged me and supported my specific goals and interests. I know that I'm lucky and I'm fortunate to have had that opportunity. I know that not everyone does. If you're able, you know, one word of advice would be, if you're able to, you know, find out some of the inside scoop about potential supervisors from students, like previous students, I'd really encourage you to do that, because it's all about the fit. And that fit can go a very long way.
awesome. Thank you so much. Our next question, this is alluding to your past experience as a leader. So you have had past roles, including a board of directors member for both the CPA Sports and Exercise Psychology section, and also with the BCPA over the past 6 years. So we were just looking for any advice that you may have for students that are looking to start their first leadership positions, any pointers on what sort of fields that they should look into, any particular methods on appealing to interviewers, anything along those lines would be very helpful.
Yeah, this is something I'm really, really passionate about. And I just, yeah, I'll share a bit of my story on that. As an undergrad student, I became the CPA campus representative for UBC. And I remember just kind of helping to facilitate some different events out here at UBC. And then when I transitioned into my master's program, the CPA student executive, so CPA has, I don't know, 30 or so sections that have different, like, you know, focuses in psychology, and one is for students. And I ran in this election to become the chair of that section. So I felt, oh my gosh, like there's no way I'd ever get elected. I got elected. And that year was the year where the chair actually sat on the CPA board of directors. So here I am, I'm this like real fresh master's student sitting among some of the, most esteemed psychologists in our country. It was terrifying. I was so nervous for the first few months. I would say it was actually the most rewarding and valuable learning experience I had by far out of all of my graduate training. I got to learn about psychology from this kind of national systemic perspective. I got to learn about, advocacy with the government, a whole whack of things. But all it took was to put myself out there, and to just go for it. Try and go for it, see what happens. Sometimes it doesn't always work out, but experiences lead to more experiences. You got to start somewhere, and just start building them up.
That's awesome. Thank you so much. As you've mentioned also, now we're looking at personal strategies. This can allude to career, this can allude to your education. This is really looking into sort of the motivation that you have, and in general, how you sort of apply your daily knowledge to sports psychology. So that question along the same lines is, what is one piece of advice that you would have students apply from the field of sports psychology to their everyday lives? Is there anything particular that can come from an athlete and anyone can apply?
Yeah, I mean, I think a general thing is kind of coming to me, although for some reason, I feel like I often use this principle with athletes. And it's pretty straightforward. It's just a phrase. The phrase is control the controllables. That's something that, I learned from one of my supervisors, and I kind of personally took it and run with it because, especially right now, there's so much happening that's uncertain and unknown out there. And it's just our natural tendency to want to regain a bit of that control, right? If we're always focused on things that are beyond our control, we're giving up a lot of our power, right? And so it's really about shifting our mindset back into controlling our controllables. What is in my control? And doing things that support those things, and working hard to let go of the things that are beyond your control. It takes a lot of practice. I'm not perfect at it by any means, but I think if applied effectively, can be really empowering for a lot of people.
Awesome. Thank you so much. This is deviating a little bit. This is looking at just what is it like in the day of a sports psychologist. So yeah, what does a typical workday look like for you, and how exactly do you maintain that appropriate work-life balance? I know a lot of us students, we sometimes get caught up in all of our extracurriculars or classes. So strategies on this would be applicable, I think, to even undergraduates who are caught up in their responsibilities, especially with the end of term.
Definitely. So I just want to, point out, so we're using this term sports psychologist, and there's an interesting whole history and background associated with that. I want to clarify. So I'm currently an applicant to the College of Psychologists of BC. So I currently don't use the kind of term psychologist for myself, although I hope to soon, if I'm, so lucky to receive my license. So I just wanted to put that out there for the group. What I can say, though, is I am providing psychological services under supervision, which is standard for people who are undergoing the process for registration as a psychologist. There's a mix of services that I provide. I have a general practice. So the general practice contains doing counseling and psychotherapy for adolescents and adults for, a wide range of different psychological concerns and mental health disorders. I also do comprehensive assessment services, something that I find really fun, and kind of the blend between clinical work and research. So I do these things called psychoeducational assessments and psychodiagnostic assessments. And then I have, a bit more of a niche area, which is the sports psychology services. And so in that space, I provide performance-related services. So that's things like helping people work through performance anxiety, experience of choking in sport. And then it's more, there's also a clinical focus, which is kind of mental health related challenges or interpersonal challenges within the performance setting. So things like sports related trauma, like hazing or bullying, or eating disorders within this performance space, like things like that. So that's kind of, there's never a dull moment. There's a lot of variety, which I really enjoy and appreciate. I also do a bit of teaching on the side, so that's another little piece that I was able to sneak in there. Okay, so yes, just to the second question here, there's always more that we can be doing, right? Particularly with this online virtual world. And so one of the things that I need to do, because I'm just a real wide-eyed, I'm always being drawn into new things and I get really excited about them. And so I really have to kind of keep your eye on the prize sometimes. What is it I'm doing now? Like, and doing those things well. So kind of creating personal boundaries, like with myself, even like to keep myself on track. I think that's something that helps me maintain work-life balance. That's setting boundaries and enforcing them with other people too. Saying no to things. It's so easy to say yes, 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 but sometimes you got to say no, and that's hard. So that's something else. And the last thing I'll say, again, not super surprising or unique, but exercise. That's something I work with a lot in sport and exercise psych. And I do that because there's, it's amazing, like what exercise can do for our physical and mental health. There's lots and lots of research about how that can be really beneficial. So I would definitely add that to the list.
Awesome, thank you. All right. So along those same lines, I know you mentioned exercise. Do you have any particular self-care practices that you use to overcome difficult days or clients? And of course, especially relating to exercise as well, how has this changed during the COVID-19 pandemic? And what sort of recommendations would you give to students during particularly difficult times?
Yeah, it's, I would say kind of creating regular habits that contain self-care, I think is really big. Because sometimes when we think about self-care, we treat it like a reward, like, oh, I did this, so now I'm going to treat myself to that. And so I would really encourage people to think about it. Oh, self-care is a regular thing. It doesn't come at the bottom of the list. Like once I've done everything else on my list, no, it needs to be prioritized. It doesn't have to be huge. It could just, be built into the infrastructure of your day. And so what I mean by that is, how can I, sometimes when I've back-to-back sessions with clients, it's about taking 5 minutes just to sit in quiet, or to just to get up and move around, stretch my legs out a bit. It's about having a cup of tea and really just kind of savoring the warmth of the tea, or having a hot shower, like things like that. One thing for me is I have a little wiener dog who made a little appearance earlier, and I just love spending time with him. He came into my life right at the beginning of my PhD program, and just changed my world and was my companion throughout that journey. And so he's been here obviously throughout COVID. He's been a stable and steady support. And so I'm really appreciative of little Pete for that.
Oh my gosh, that's such a sweet name. All right, great. So now we will be moving on to student questions. This is just a reminder to all of our participants that if at any point you do have any more questions that you'd like to ask, please feel free to drop them in the chat. We do have people moderating, so we will be incorporating those as we proceed through the talk. So starting off with our first student question that we had sent in, how would you sell the topic of sports psychology to students who are interested but unsure of careers in psych? You've mentioned very frequently that counseling psych is a great option for students. If you have any more insight regarding that, that would be great.
Yeah, so there's counseling psych, which you can educate yourself on some of the differences there. There is a lot of crossover though. We all obtain the same unspecialized license, which is registered psychologist. So that's a whole other conversation, but certainly there's that. Within the sports psych space though, this is, a relatively new thing, in terms of it being a profession. So I would say that for someone to think about having a full-time career working in the sports psych space is few and far between. Like, we're not there yet, I think, as a Canadian society. In the US, might be a different story because, for many different reasons, the landscape's a bit different down there. So if you are interested in working, in the performance space, if you're interested in sport and kind of working in that type of culture, I think it's a really good option. But I do think it's important to also develop, a well-roundedness of skills, a diversity of skills. So to specifically address this question, I think it's important to have as a component of your practice, with the hope that in the future the profession will expand. And I also think it's kind of cool to work in a general practice as well, because for me that's also what originally drew me into the field.
Awesome, thank you so much. I know that out of our participants, we do have psych students, but we also have students from the kinesiology faculty. So just a quick question regarding that. How exactly does having a kinesiology background apply to this field of sports psychology? And is it needed or like a particular focus for specializing in sports psychology?
Yeah, so this is a great question. So like I said at the beginning of the talk, there's typically two pathways to practicing in the sports psych space. And there is crossover. So I did take sports science and kines courses and do practicums in those spaces, and kind of vice versa. If someone, wants to obtain this credential, it's called a mental performance consultant, then those folks from kinesiology in sports psych will have to cross over into psychology and into counseling to obtain some training as well. Yeah, I would say that kind of in most cases, I don't know if a background is the right word in kinesiology, but certainly some understanding of kinesiology and sports science will be helpful in the sport, in applied sports psychology for sure. And there's something about research, to do research. I think just to the question around research, I would say it just depends on what the area of work you're doing. So if you're doing kind of mental health in sport, do you need to come from a kines background? Maybe not, but maybe. So I think it just really depends on what the research you're hoping to do is.
Gotcha. Okay, thank you. And this is also sort of alluding back to when you were describing those different paths on specializing in sports psychology. Did you ever face any sort of fork in the road scenarios where you had a choice between different things in your graduate degree, undergraduate, and how did you decide between them or integrate them into your professional career?
Yeah, I mean, I think I just, humbly say that we're all still learning. Like we're all learning, and I'm definitely still learning. And so I think it's like, you know, staying true to interests and passions and trying to explore them and pursue them. That's something that I really try and live by. But also seeing things as an opportunity. It's kind of like, here's this thing, it doesn't sound as interesting to me, but trying to explore it anyways to see if there's anything at all that you can gain from it, even if it's learning that you don't like it, kind of thing. So pursuing interests, seeing things as opportunities, I would definitely underscore. And what's cool about the psychology profession is that you can do a number of different things, particularly at the doctoral level. You can do teaching, you can do research, you can do administrative work, and of course there's the practice piece. So I know folks who weave all of those into the work, and so it really is a cool field that allows you to do a number of different roles, and you can shape how you want that to look like for you.
Awesome. Thank you so much. All right. So this is a bit more research related. These are student questions, so they come from a variety of different backgrounds. So I know that you did your master's in dissertation on athletic identity after the end of their athletic careers. Do you have any particular sort of inside scoops on sports injury and the research regarding motivation in that field?
Yeah, this is the sadness of a sport injury, the loss of a sport injury. Just every time when I think about that, it's just, I know how devastating that could be for a lot of people. So of course, everyone experiences and processes those sport injuries differently. So you'll get a person who remains pretty optimistic and doesn't experience much loss, and they'll have their outcomes. And in contrast, you might have a person who is suffering a lot of grief, a lot of questioning about their identity. They might develop some more complex kind of mental health symptoms. So really just depends about the characteristics that each individual brings and some of their kind of internal, external resources. This question is specifically about motivation. And let me think about that. Here's one thing that's coming to mind, because I know there's lots of things, but one thing that when I'm working with with athletes who are undergoing kind of sports rehabilitation from injuries, again, it's this principle of what am I learning now? And I don't want to be in this position, like who wants to be injured, but what am I learning now that I couldn't if I wasn't injured? Like, again, it's trying to see it as an opportunity. What am I learning about myself in terms of my ability to overcome adversity? What am I learning about the sport? Like, am I able to take on a new role on a team? Like, I know some people that kind of take on the camera person role. They're responsible for filming training. And then perhaps you can analyze that film in a different way than you would have if you were competing. So people can take those hurdles and those obstacles that they face and try and turn it into something that actually, as they return to play, can be beneficial to them. Awesome. And I think that relates to motivation.
Thank you so much. All right, this next one is, what is the biggest misconception about sports psychology, and what is one thing that you wish more people knew about the field?
Well, I think one of the biggest misconceptions is the term sports psychologist. Like, funny enough, because that term, people can, for some reason, relate to it. That's kind of part of the title of our talk, because automatically people kind of understand what we're talking about. But at least in Canada, I believe, and for sure in BC, there isn't a specialty degree or a specialty kind of area of practice in sports psychology. as I mentioned, the College of Psychologists will regulate psychology practice in certain areas, and sports psychology is not one of them. And so the term sports psychologist actually is in some way incorrect, and it's a protected title. So people shouldn't actually call themselves that. Anyway, so it gets a bit complicated. And then I think it becomes further complex because you'll have kind of two different types of professionals working in the space. As I mentioned, there's the stream from kinesiology, and then there's the stream from psychology. And the public, it's up to the public to try and kind of figure all that out. And so we need to do our best to help educate people, to really outline the scope of practice, and kind of support one another, in terms of professionally and cross-professionally, to make sure that, we're providing the highest quality of collaborative care that we can.
I see. Awesome. Thank you. All right. So that is the end of our planned questions for the talk. It is, oh no, I'm a different time zone, 5:45 right now. There we go. Hope that's right. So the last 15 minutes are reserved for any students, any participants who have any questions for Dr. Giannone. Just looking at the chat, we do have one question. This is from Angus Chan. What are the biggest sports performance related psychological strategies that we can use as universities to tackle high stress situations?
Yeah, this is okay. So sports related, okay, now I'm getting distracted here. Okay, so sports performance kind of strategies that can be translated into the academic context. Well, there's lots, because, when we think about sports psych, really, we're drawing from this field of performance psychology. And so those skills are, translatable into, or transferable into, other high performance settings, like in, emergency medicine or in the performing arts, and of course into academia, where all you are at currently. So, it depends on the situation, right? There's nuance to how one might kind of integrate an intervention or strategy. But one thing that is coming up for me right now is, I think back to, even our own performance anxiety that we have related to test taking. Like, that's a classic one. And so there are strategies that I would use when working with athletes, that I'd also use when I'm working with students who are experiencing the same types of symptoms. And one of those things, I'll just say one of them because there's lots, is one of the most basic things we have, and that is to help learn how to breathe and how to regulate our breathing. And why that is one of the leading ones for me is because when we think of our kind of stress response, the anxiety response, we know that our central nervous system hijacks our thinking brain. And really, we need to calm ourselves down before we're able to kind of bring our executive functioning back online, right? And so learning how to breathe properly and learning how to breathe when we need to for those purposes can be hugely, hugely impactful, both in sport and when performing for school.
Gotcha. Thank you. Our next question comes from Caitlin. As a gymnastics coach, what are some steps that I can take to help my athletes overcome their mental blocks?
Yeah, mental blocks. So again, it's really hard to be, to be prescriptive, right? But I would say something that's worked in my own practice, just generally, and usually the first step towards working with clients or groups is helping people raise awareness about the experiences that they're having. So, when you talk about the mental block, it's hard to know what to say to them or to how to support them if we don't know what's happening for them, but if they don't know what's happening for them. So part of it is really helping them kind of track their experiences, both, cognitively, behaviorally, physiologically, emotionally, all these different points of our experiencing. And then together kind of analyzing that, like figuring out, well, what's the pattern here? And then really trying to tailor the approach to whatever, whatever unique factors that are happening for that specific person.
I see. All right, thank you. Just looking. All right, we have a question from Fatima. Have you had the experience of treating someone who was suffering from performance anxiety in sports? And I'm guessing what strategies did you take in helping them out?
Yeah, it's something that I've worked with quite a bit. And again, like working with the athlete culture, like having understanding of that space, which is different across sports and which is different across teams. Like it's, I think can be really, really effective. But often I draw upon, the typical literature that's out there in terms of kind of, there's crossover with social anxiety, with kind of performance related, not performance, what am I saying? Yeah, I think it is performance anxiety. I think I'm butchering my words right now, but kind of a specialized area within social anxiety, which essentially captures this idea of kind of, feeling, pre-competition anxiety or within competition anxiety. So anyways, there are lots of different ways to address that. Some of my go-tos are helping build skills around kind of mindfulness, building skills around kind of self-compassion. So working through both behavior and through thought, kind of trying to kind of help people help themselves in terms of helping them regulate themselves through breathing, through kind of arousal control, which is either up or down, so that they find their optimal kind of zone of performance or functioning.
That sounds awesome. Honestly, I think that's very applicable even to academic areas when you're going into something that's like, for example, an exam that's stressing you out. That's awesome. Thank you. We have 2 more questions here. As an undergraduate student who's looking to apply to a master's in counseling psychology, what are some key experiences that I should have in order to be a competitive applicant?
And sorry, did you say counseling psych?
Yeah, counseling psychology.
Okay.
Yes.
Yeah. Okay. So I would say that, the criteria is largely the same between a clinical and a counseling psych program, right? They're going to look at the basics, like, and you all probably know this, like GPA, research experience, and some of the more applied, experiences like working with people, with children, or volunteering, whatever, right? All bringing rich and diverse kind of experiences to help support that narrative that I talked about earlier. One thing to think about with counseling psych, particularly at the master's level, is that there's 2 different programs. There's an MA program, which is the research stream, which leads into the PhD, and then there's the MEd, which is a non-research stream. And the master's degrees in counseling psych are terminal, and it prepares people to practice as counselors, which is a related but distinct profession from psychology. I think what I'd say to someone considering the master's degree is really, again, it's that story. This is just my perception of the admissions folks in the program, at least UBC, is that they really care about, evaluating people holistically. And I think that really makes for good counselors. So if you're able to convey that through your application, I think you'll be set up quite well.
Awesome. Thank you so much. And along those same lines, do you have any particular advice for students who are interested in sports psychology but don't know if they want to commit? Are there any particular things that a student could do to explore that interest further before necessarily applying for a graduate program?
Yeah, I love this idea. And I think it's so important in like so many different decisions that we're faced with, which is like, how do you commit to something you think might be interesting, you think you might be skilled at it, but you just don't have any evidence to base those decisions off of, right? Like we've all faced situations like that. For me, one of the ways in which I've kind of worked through that is to volunteer, right? Whether that was volunteering in a research lab in my undergrad, or trying doing a practicum in an area where I just simply wasn't sure. You can learn a lot through putting yourself in that position, in the context in which something happens. So in this case, specific to sports psych, trying to connect with a professor who does research in that area, or a practitioner who provides service. So you might not be able to provide the service yourself, but maybe you can shadow them or join them on, some type of professional development. So I do think there's ways to get involved and to learn about yourself and your interests. You just have to be a bit creative.
Let's see. We did have a few more questions pop up actually.
Sure.
Just looking here. What sports are the majority of your clients involved in? And are there common mental challenges that these athletes face?
Yeah, I would say, I've been lucky to have a variety of athletes that I've worked with. I did a lot of my training within the varsity context, right? So within intercollegiate or interuniversity sport. So sports associated with that, I've experience with, or most of those sports. So, football, soccer, there's volleyball, track, rugby, take a look at the different websites. And, it's really hard to say about common presenting problems. I'm sure there are themes, like if it really came down to it and I was trying to identify those. What I can say is that obviously human beings are really complex. And when I first got into this work, I always thought, oh, there's going to be one issue. Someone, for example, might be struggling with depression. The longer I do it, the more I think it's not really the case. It's like someone is struggling with depression, but they also have this and that. And it's never straightforward. So really it's about the art and the science of the work. How do you kind of understand and apply principles, and that's kind of the science. And then the art, it's really being with a person, sitting with them and doing that in a way that is effective all at the same time.
Wow, thank you so much. That's a very in-depth answer. We actually have a pretty specific clinical question. What are your thoughts on the increasing engagement in early specialization sports rather than stressing free play in children's younger years? And then there's a few more questions that add on to that, but if you'd like to answer that first one first. I think you can see it in the chat.
Yeah.
For the people in the recording, the other parts of the question are, would late specialization sports be a better method for fostering a lifelong interest in sport or exercise participation? And does relatively later retirement in later specialization sport correlate with generally higher levels of enjoyment in sport?
Those are really good questions. Maybe we'll tackle the first part first, which is, this has been a really well debated topic recently. There's been a lot of spotlight kind of shown on this idea of early versus late specialization. The research currently points to kind of later specialization as being, I don't know if I'd say better, but kind of favorable perhaps at this venture in time. I don't know, it's interesting, right? We have to follow the research. We have to, trust in the science. I kind of smile and pause because I think about my own experience as someone who did. I think I did specialize early in soccer, but at the same time, I played lots of other sports too. So maybe I didn't. I don't know why I'm having that thought right now. But so yeah, the science is pointing to this idea of later specialization. I would say just, generally speaking. And the next part is, does that foster a lifelong interest? Or is that, more strongly correlated with this lifelong interest? And I can't say that I actually am aware of the research that would either support or kind of not support that type of question. I think we can all speculate about that, but I really can't say that I'd be able to respond to that with any kind of sense of confidence right now. Yeah.
All right. And there was the last part to the question. Oh, okay. I see. All right. Thank you. And it is 5:56. We do have, another question popped up. Thank you, Angus. Do you think that it is easier to offer effective psychotherapy, i.e. motivational impetuses for team sport athletes than solo athletes because of the bigger peer motivation aspect in team sport?
That's interesting. I would say it depends. It depends on the group. I don't know, this is not based on research, although I bet you it could be. I find there's often a period in which you start to work with a team that there's a kind of a feeling out process that happens on both ends of the clinician and on the team. You're asking to join their culture, to let you into their dynamic. And I think that sometimes can take some time. Once you get kind of working and once you're accepted into that culture, can that peer motivation be really powerful? I would absolutely agree that it can. But that's not to say that the working alliance or the therapeutic alliance in individual therapy or counseling isn't powerful too. So really what I'd say is, what we know about individual service and group service is that they're both effective, but perhaps they're effective for some similar reasons, but also for some different reasons. I actually looked at that a bit for my dissertation. So this question, while again, I think to speculate, I could, see that being a factor that could impact. I think there's so much nuance to both individual and group that it's, I think at this point, with little information, hard to say.
All right, thank you so much. That appears to be the end of our student questions. I will now pass this on to Daniel for our concluding notes. Thank you so much, Dr. Giannone, for your insightful answers and for all of your advice for undergraduate students and graduate students alike. You've really helped provide an in-depth perspective on this field. Thank you so much.
Thank you, Katerina. So that's our time for today. Thank you so much, Dr. Giannone, for your thoughtful answers. I really thought that the idea of controlling the controllable, that really resonated with me. Sometimes, I can feel overwhelmed with all the things going on, and it's helpful to sit down and sort of sort things into, I can do something about this, and I can't do anything about this, so I shouldn't worry about it too much. So if any of you would like more information about our super amazing speaker, please visit her blog at zarinagiannone.wordpress.com. We can have that copy and pasted into the chat so you can click directly onto the link. And thank you to everyone who made the time to attend our event. It's final season and we all have exams to study for and papers to finish. So it really means a lot that you found the time to come today. The Expert Talk series is a bi-weekly event, but this will actually be our last one for the year of 2020. Our next event will be on January 8th, where we will be inviting Dr. Michael Gordon, who will be doing a presentation titled The Myth of Mental Illness, a discussion of trauma, adaptation, and self-actualization. Make sure to follow us on social media for more information. thank you all for coming, and thank you again, Dr. Giannone, for your amazing answers, and have a wonderful day.